I want to talk about UTIs. I've got chronic illness and I was bedbound in 2020. So if you're new here, I've got a chronic illness called a chronic UTI. Chronic UTI is where the bacteria is embedded into the bladder lining. What I want to highlight today is specifically UTIs in pregnancy. The usual UTI symptoms that you may have out of pregnancy may be completely different in pregnancy. Now this applies to people that even don't have a chronic UTI, who don't have interstitial cystitis. Like this can apply just to normal pregnant women who get UTIs. And that is because your hormones are changing, your body's changing, your physiological state is changing, your pain receptors are changing. So what you once maybe thought was a UTI may look like completely something different in pregnancy. I was actually UTI free before I got pregnant. However, because my infection is embedded, the hormones have actually caused the infection to flare. However, I didn't know I was flaring because my symptoms as a pregnant woman were completely different to a non-pregnant woman. Prior to pregnancy, I would get completely different symptoms. A sort of standard UTI where it would be burning, you feel like you're peeing acid essentially. However, being pregnant, it was like something has changed. And I was getting, every time I would void, I would get like aches and pains all around my pelvic region, which I'd never experienced before. Now, I thought that was just the baby. I thought that was just being pregnant. However, this was actually caused by UTI. So I just want to raise awareness that if you have pelvic pain during pregnancy, it could be a UTI and you need to get that sorted.